Thank you for taking time to watch this video and for choosing Community Hospital. The purpose of this video is to help you better prepare for your upcoming total joint replacement. This video is meant to supplement the total joint replacement booklet that you received from your provider. Please reference it with any questions you may have. The information here is meant to be a general overview of expectations of your procedure. More specific education will be provided following your procedure based on each individual case. Please consider watching this video with a family member or friend who might be able to serve as a caregiver following your procedure. We are committed to providing the highest quality healthcare to you through our team of surgeons, nurses, therapists, and other ancillary staff. If you have any questions following this video, please contact your orthopedic surgeon. When your pain has become severe enough to interfere with daily activities and/or it interferes with your ability to perform normal work activities, likely the best choice for you is a total joint replacement. Total joint replacement has been shown to be an effective treatment option to relieve pain and improve function for an arthritic joint. Our goal is to provide each of our patients with a team approach to guide you through your orthopedic procedure and recovery. However, the most important member of your team is you. Your commitment and participation are vital to a quick and successful recovery. As a member of the team, your responsibilities include following the steps that are being outlined today for your preoperative appointments, preparations, and planning. Use your total joint replacement book as a guide to assist you in preparation of your upcoming surgery, as well as a reference or a resource during your hospital stay. And be sure to bring your booklet with you to the hospital. Ask questions. If you are unclear on any aspect of your upcoming procedure or hospital stay, or during your hospital stay, please don't hesitate to ask. Most importantly, participate in all aspects of your care. The initial days of recovery can be demanding and uncomfortable. Our goal is to assist you in returning to your normal activities as quickly as possible. The more you participate, the quicker the recovery. It is important to maximize your overall health prior to undergoing a joint replacement surgery. Exercising up to the day before your surgery helps improve your strength, range of motion, and endurance. This helps lead to a successful outcome in recovery. You may be referred to see a physical therapist to assist in developing an exercise program prior to scheduling your surgery. Why is exercise important to your recovery? Strengthening exercises for the hip and knee joint improves recovery. Upper body conditioning exercises help reduce muscle soreness and fatigue caused by the use of a walker. Healthy eating and proper nutrition before your surgery aids the healing process. Some tips to follow include drinking plenty of fluids to stay hydrated, getting plenty of protein, and eating foods rich in iron, high in vitamin C, calcium, and fiber. We recommend that you eat light meals, especially the day before your surgery. The combined effects of anesthesia and your medications may slow down your bowel function, which can cause constipation after surgery. Managing your blood glucose is always important, but it is extremely important before surgery. In fact, managing your blood glucose before surgery can help reduce the risk of problems after surgery, such as infections and other complications. Smoking causes breathing problems, increases the risk of medical complications, delays healing, and slows recovery. Smoking also increases the risk of infection and blood clots after surgery. Smoking cessation programs are available in our area. Please let us know if you need resources on this. You will need a walker to help take pressure off your new joint while walking. We do recommend a front-wheeled walker with 5-inch wheels rather than a 4-wheeled walker or a walker with a seat. This should be obtained before your surgery and is typically covered by insurance. Occupational and physical therapy will sometimes recommend other equipment that will aid in independence of getting dressed and bathing. This type of equipment is not normally covered by insurance, so we recommend asking friends or family if you can borrow this equipment. This equipment is also available to purchase at our Canyon View Pharmacy. Additionally, a raised toilet seat can be very useful, as it can be difficult to get up and down from a traditionally lower toilet seat. If you have a bathtub, a tub transfer bench can be a good option to help you safely transfer in and out of the tub and reduce your risk of falling. If you have a shower chair is also a good option for safety, so you are not needing to stand the entire time, and it helps reduce the risk of falling. Again, this type of equipment is not normally covered by insurance, so we recommend asking friends or family if you can borrow this equipment. This equipment is also available to purchase at our Canyon View Pharmacy. Prepare for your return home by removing as much clutter as possible and anything that could cause you to fall. Make sure you have a proper chair to rest in. Put anything you frequently use within arm's reach. And arrange pet care if needed, and prepare meals ahead of time. It is very important to arrange for someone to assist you when you go home for the first week, as this has proven to be extremely important to your success. Before your surgery, you may visit your primary care provider, who will perform a thorough exam and order an EKG, chest x-rays, and lab tests. The purpose of this visit is to make sure that you are ready to undergo surgery. Your primary care provider will review all test results and relay the information to your orthopedic surgeon. Together, they will decide if you are ready to have your surgery. You will also see your orthopedic surgeon or the physician assistant one last time to review the anticipated procedure and to get any questions answered. They will also provide you with special instructions for bathing the 2 days before and the morning of your surgery. You will be provided with the proper cleansing agent to use. The pre-admission nurse at the hospital will call you prior to your scheduled surgical date. Plan for this appointment to last 30 minutes to 1 hour. The registered nurse will ask you many questions about your medical history, medications, and allergies. Be sure to have a list of your medications, including herbal supplements, with doses and the time that you normally take your medications. As the registered nurse reviews your medication list, he or she will discuss what medications you need to take the night before and the morning of your surgery. If you have additional questions, please ask. The day of your surgery is a very busy day. As many as 5 to 6 hours can pass before the entire pre-op, surgery, and recovery process is complete, and you are moved to your hospital room. Please inform your family and friends who accompany you to the hospital of this time frame so they are prepared. Here is a list of items of what to bring and what not to bring to the hospital. Please refer to the booklet for a full list of items. On the day of your surgery, you will be able to meet with the surgeon one last time so they can mark your surgical site. Community hospital surgeons, anesthesiologists, and staff have developed a program to enhance recovery, minimize narcotic use, and get people out of the hospital faster with better mobility and faster return to normal function. The surgery will take approximately 1.5 to 2.5 hours, after which you will be immediately moved to the post-acute care unit in your hospital bed, where you will be closely monitored by nursing staff for about an hour before being moved to your hospital room. The nursing staff will help assure you that you are safe and comfortable as you come out of anesthesia. Following your surgery, your nursing staff will be checking in on you frequently. Your nurse will monitor your blood pressure, heart rate, breathing, and temperature on a routine basis. They will check your bandages and change them as needed. Check your IV and also monitor your pain level and administer pain medications as needed per the physician orders. They will also administer antibiotics that are prescribed before and after a joint replacement to help reduce or eliminate the risk of infection. Preventing blood clots is important. Blood clots can occasionally occur due to long periods of bed rest following a procedure. As a preventive measure, anticoagulants are typically prescribed to prevent blood clots from forming or getting large. After surgery, you will be taught how to use an incentive spirometer, which is a plastic apparatus that helps you expand your lungs fully by inhaling deeply through the mouthpiece. Nursing staff will assist you with getting out of bed to a chair or toilet following your surgery. It is important to use your call light for assistance to avoid a fall until you have been cleared by therapy to perform out-of-bed activities safely on your own. A good way to remember to ask for assistance is call, don't fall. Physical therapy and occupational therapy after your joint replacement surgery are critical aspects of your recovery. Although you may experience pain during and after your therapy sessions, it is necessary for your recovery. The therapists work closely with the nursing staff to ensure that proper medications are administered prior to initiating therapy in order to allow you to perform treatment activities with minimal pain. A physical therapist will most likely work with you on the day of your surgery, depending on the time you are transferred to your hospital room, but no later than the morning after your surgery. They will work to get you up and going again and will teach you how to position yourself for the greatest comfort while in bed, move from a lying down to a sitting and sitting to standing position, walk with an appropriate assistive device, such as a walker, walk up and down stairs with an appropriate assistive device, comply with hip and knee precautions while performing all of the previously mentioned activities, and perform a home exercise program for improving your range of motion and strength on your own following discharge. In most cases, we aim for same-day discharge. This means discharging you home the same day you have your surgery. There are many factors that can affect this, but if all discharge criteria is met, patients can return home the same day as their joint replacement surgery. Discharge criteria include making sure that your pain is controlled, that you can walk safely with a walker, nausea and vomiting are controlled, you are able to keep food and fluids down, normalized vital signs, and return to normal bladder and bowel function. Typically, our patients who have undergone total joint replacement will go directly home the same day. You and your orthopedic team will decide exactly when the best time is for you to leave the hospital, based on how well you achieve your goals to regain your independence as you transition to your home setting. Occasionally, it is in the best interest of a patient to be transferred to a rehabilitation center to continue therapy prior to a safe return home. But again, this will depend on your particular situation and requires authorization from your insurance. It is important to understand that there are established criteria that must be met in order to be eligible for a transfer to a rehabilitation center. Our case managers will also be speaking to you about any specific needs you have during your hospital stay, as well as after your return home, and they can help provide you with resources that are available to help meet those needs. Our goal is to minimize any post-surgery complications. When it comes to effective pain management, the tips you learned in the hospital also work at home. Preventing infection is important. Notify your surgeon immediately if any of the following symptoms develop, including a persistent fever of higher than 101, shaking or chills, increasing redness, tenderness, or swelling of the joint incision site, drainage from the surgical site, or increasing joint pain with both activity and rest. Avoiding pneumonia is also very important following surgery. Continue to use your incentive spirometer after you get home during waking hours. Increase your activity level and continue your exercise program. Exercise and walking help to decrease your risk of pneumonia. To help avoid constipation following your surgery, drink at least 8 glasses of 8 ounces of water daily. Increase your fiber intake. Use laxatives as needed while on narcotics. And remember that walking and exercise also help prevent constipation. Preventing blood clots is very important following surgery. Continue your blood thinner as directed during your hospital stay. Increase your walking distances daily to help minimize your risk of developing blood clots. And be sure to review these prevention strategies as well as when to call your doctor in your Total Joint Replacement booklet. Thank you for choosing Community Hospital for your upcoming surgery. We look forward to caring for you before, during, and after your surgery. Please read through the educational booklet for additional information.